Today we're talking about plantar fasciitis. Disclaimer: if you are currently experiencing pain in your foot, please consult a doctor or rehab specialist. The following information should be used for educational purposes only, as it's advice that I would give to my own patients. So what is plantar fasciitis? It's a common condition characterized by pain and inflammation of the plantar fascia, a thick band of tissue that runs along the bottom of the foot, connecting the heel bone to the toes. It often causes stabbing pain near the heel, especially with the first steps in the morning or after long periods of rest. The exact cause of plantar fasciitis is not always clear, but it is often associated with overuse or repetitive strain on the plantar fascia, such as with excessive running or standing for extended periods. Flat feet or high arches, which can lead to abnormal stress on the plantar fascia. Tight calf muscles or Achilles tendon, which can affect foot mechanics and increase strain on the plantar fascia. Obesity or sudden weight gain, which can increase pressure on the feet. Treatment for plantar fasciitis typically involves a combination of self-care measures, lifestyle modifications, and medical interventions. Here are some of the treatment options. Rest and ice. Resting the affected foot and applying ice packs intermittently can help reduce pain and inflammation. Stretching exercises. Stretching the calf muscles and the Achilles tendon can help alleviate tension on the plantar fascia. Night splints. Using night splints that stretch the calf muscles and plantar fascia while sleeping can help reduce morning pain and stiffness. Non-steroidal anti-inflammatory drugs, or NSAIDs. Over-the-counter pain relievers such as ibuprofen or naproxen can help reduce pain and inflammation when pain is particularly bad. Surgery. In very rare cases where conservative treatments fail to provide relief, surgery may be considered to release the tight plantar fascia or remove damaged tissue. The above listed are potential treatment options if you actually have this problem, but I believe very strongly in active rehab as well as preventative medicine that include incorporating movements and exercises into your daily routine that counteract conditions such as plantar fasciitis. Here are a few suggestions. In terms of lifestyle modification, there are two big things you can do to prevent plantar fasciitis. The first is very simple: go barefoot on a regular basis. This will help to strengthen the intrinsic muscles of the foot that are typically weakened by being in what I like to call foot jail, or in other words, wearing shoes. Our feet are meant to be free. We weren't born wearing shoes, and doing so, that support that those shoes are meant to provide also works to do the opposite. In supporting the multiple arches of the foot, these very shoes actually weaken the muscles required to do that very job. It is important to note that strong and healthy feet set the foundation for a strong, healthy body. If you're not used to going barefoot, I suggest starting with a little bit of time each day working and moving around the house. You can build from there. The other thing that I highly recommend is to make sure you purposely engage in a variety of physical activities. Keep in mind that training for specific things, especially if you are not a dedicated athlete, can lead to certain overtraining injuries. Plantar fasciitis is a common overuse injury that plagues athletes, in particular those who do a lot of running. So if running is not your bread and butter, and I say this because there are so many recreational runners out there, then change it up. Add in some strength and mobility training. Very important. Walk instead. It can be just as effective. Bike, swim, dance, garden, etc. Fitness isn't about exercising up to the point that you end up hurt. It's about moving in ways that keep you healthy long term. As for specific exercises, you can include the following into your workouts or simply your daily routine. Calf stretch. Stand facing a wall with your hands against the wall at shoulder height. Step one foot back and keep it straight while bending the front knee. Lean forward until you feel a stretch in your calf at the back of the leg. Hold for 30 seconds and then switch legs. Repeat 2 to 3 times on each side. Towel stretch. Sit on the floor with your legs stretched out in front of you. Loop a towel around the ball of one foot and gently pull the towel towards you while you keep your knee straight until you feel a stretch in the bottom of your foot and calf. Hold for 15 to 30 seconds and then switch feet. Repeat 2 to 3 times on each side. Plantar fascia stretch. Sit on a chair and cross one foot over the opposite knee. Using your hand, pull your toes back towards your shin until you feel a stretch along the bottom of your foot. Hold for 15 to 30 seconds and then release. Repeat 2 to 3 times on each foot. Toe stretch. Sit on a chair and place a tennis ball or similar object under your foot. Roll the ball back and forth from your toes to your heel for 1 to 2 minutes. This helps stretch and massage the plantar fascia and the intrinsic muscles in the foot. Towel curl. Sit on a chair with both feet flat on the floor. Place a small towel on the floor in front of you. Use your toes to scrunch up the towel towards you, then release. Repeat for 10 to 15 repetitions. This exercise helps strengthen the intrinsic muscles in the arch of the foot. Marble pickup. Sit on a chair with a bowl of marbles or similar small objects on the floor in front of you. Use your toes to pick up one marble at a time and place it in another bowl beside you. Repeat until all the marbles have been transferred. This exercise helps strengthen the intrinsic muscles in the toes and in the arch of the foot. Ankle alphabet. Sit on a chair with your feet lifted slightly off the floor. Pretend your big toe is a pen and use it to write the alphabet in the air. Repeat with the other foot. This exercise helps improve ankle mobility and strengthen the muscles in the foot and ankle. Following preventative measures such as maintaining a healthy body weight and not overdoing it with certain activities, yes, runners, I'm talking to you, that exacerbate symptoms can help prevent plantar fasciitis from recurring. I hope this video was helpful. Pass it along to someone who needs this information. As always, that's been a word from Dr. Chris here at Human 2.0, where we are dedicated to making the world a healthier place, one person at a time.